My name is Caleb Sullivan. I am a University of South Alabama student nurse, and I'll be performing my medication administration checkoff. And I'll scan the room. The first thing I'll do is I'll make sure I'm in compliance with my agency's no interruption zone policy, meaning I will have the doors closed, I will not be fielding any phone calls, and I will limit all conversation with colleagues to only essential information. And I will compare my patient's MAR with his chart, making sure I have the right patient. Jaguar J. Jones, medical record number 4176352, medical record number 4176352. Making sure I have the right medication, Novolin R, 100 unit per milliliter insulin, also called regular insulin. Novolin R, 100 unit per milliliter insulin, regular insulin. Right dose, 10 units. 10 units. Right route, subcutaneously, and right time, 30 minutes before meals, and 30 minutes before meals. And I could see that it's 30 minutes before his meal. He has not had the medication within the last few hours. I will also assess for any allergies. So I see allergy to penicillin and penicillin. So at this time, I'll move over to the medication area, performing proper hand hygiene. And I would grab the right vial of medication according to the MAR. As I begin to prepare for my first check of accuracy, I'll again check, making sure I have the right patient, Jaguar J. Jones, medical record number 4176352, medical record number 4176352, making sure I have the right medication here. So Novolin R, 100 unit per milliliter insulin, or regular insulin, and check the expiration date, which is 12/1/2025. Okay. Next thing I'm going to do is I'm going to verify the right time for the medication, which is 30 minutes before meals, and I can see that it's 30 minutes before meals, and he has not had the medication within the last few hours. Next thing I'm going to do is check the right route, which is subcutaneously. And for this subcutaneous insulin injection, I'll be using a 1 milliliter or 100 unit insulin syringe. And I'd like to make note that my insulin syringe does not have a safety cap. Okay, next thing I will do is I will cleanse my vial with a brand new alcohol pad going in a circular motion. I will now remove the cap from my insulin syringe, withdrawing 10 units of air per the order. I will now insert my syringe into the vial, releasing the air. And I will now draw back more than 10 units of insulin. This way I can remove any air bubbles. And then I will return the amount to 10 units. I will use the scoop method and secure it in place. Now once again, check my dose with the MAR. Check 10 units, 10 units. And at this time, if I needed to verify my dose with another nurse, I would do so. And now with the vial, the syringe, and the MAR, I will do my second check for accuracy. Once again, checking my patient, Jaguar J. Jones, medical record number 4176352, medical record number 4176352, making sure I have the right medication, Novolin R, 100 unit per milliliter insulin, or regular insulin, Novolin R, 100 unit per milliliter insulin, or regular insulin, the right dose, 10 units, 10 units, 10 units, right route, subcutaneous, and right time, 30 minutes before meals, and 30 minutes before meals, and I can see it's 30 minutes before, and he has not had the medication in the last few hours. So now at this time, I will prepare a medication label. This label will have the patient's name, which is Jaguar J. Jones. The name of the medication, Novolin R, 100 unit per milliliter insulin, or regular insulin. And the right dose, which is 10 units. Now we'll administer this to the syringe. And now at this time, I will proceed to the patient's room with my syringe and my MAR. And before entering the room, I'll perform hand hygiene. As I was entering the room, perform hand hygiene. I will check the patient's identity via his armband with two methods. So Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. And I would assess for any allergy. So I see an allergy for penicillin. And I would ask the patient if he had any other allergies that I needed to be aware of. And also at this time, I'll perform any pre-administration assessments that needed to take place depending on the medication. And at this time, I will also do my third check of accuracy. So making sure I have the right patient, Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. Right medication, Novolin R, 100 unit per milliliter insulin, or regular insulin. The right dose, 10 units. The right route, subcutaneous. And the right time, 30 minutes before meals. And I can see it's 30 minutes before his meal. He has not had the medication within the last few hours. So at this time, I would explain the procedure to the patient. So Mr. Jones, we will be performing a subcutaneous insulin injection today, and you should just feel a little pinch. And I would also raise the bed to a proper working height and lower the side rails. So at this time, I'm going to put on my goggles and my gloves. And I would select the right insertion point, and we will be performing it on the dorsolateral aspect of the upper arm, which is 3 fingers down from the deltoid insertion on the humerus and 3 fingers up from the olecranon process of the elbow on the lateral side of the arm. And since this is an insulin injection, we will be going at a 90-degree angle, and we do not need to aspirate. Okay, so I will cleanse the skin, going in a circular motion from the center. And I will leave this clean alcohol pad on the showing where I will be performing the administration. And I will remove the cap and dispose in the sharp container. And as I am pinching the skin, I will go at a 90-degree angle and slowly administer the medication, immediately discarding the cap in the sharps container and applying pressure to the wound. Okay. And at this time, I would return the patient to a comfortable position, lower the bed to the lowest height, and raise the side rails. And I would remove my gloves, going glove to glove, skin to skin, and discarding in the trash can. Performing proper hand hygiene, and check the patient for any reaction to the medication. And then at this point, I will be performing my sixth right, which is right documentation, and I will document the patient's reaction. I will document the procedure and the patient's tolerance of it. And then later, I would come back once again to check and see if there was any reaction to the medication. And this concludes my administration checkup.